Welcome to another episode of the Your Company Health podcast. My name is Andre Wright, and today I have the pleasure to be with me, Dr. Amir Rashidian. Uh, Doctor, how are you? And welcome to the podcast.
Thank you, Andre. I'm doing good. You can call me Amir.
Amir, okay, okay. All right, Amir. It's always fun talking to, healthcare providers and just to have that discourse about, what you're doing in the community and how well you're scaling your practice and you're taking care of your customers. So to get things going, I want to tell us about your story and why chiropractic.
Yeah, well, I was 9 years old when I decided I had to become a doctor, and that's because my father and I were traveling in these remote villages in Iran, and a woman had gone into labor, and there were no hospitals or doctors in this village. A midwife came over and knelt down and examined her and said, "I'm sorry, there's nothing I can do." And she said the baby's not alive and the mother's not going to live much longer, and she actually left. And at the age of 9, I was looking into the eyes of this young woman who was just told she's not going to live another few hours. And she was, crying. Her husband was next to her crying. And I started to have this big panic attack where, your chest feels tight and your heart's pounding. And I was having trouble breathing and tears are coming down my face. Well, my father saw me, he picked me up, he held me, he carried me out of there. He calmed me down, and then two of us climbed down the mountain. We got in our car to drive home. On the drive home, I said, I don't want to feel like that ever again. And my father asked a really good question. He said, "What are you going to do about it?" I said, "Well, I guess I'll go be a surgeon. I'll be the best surgeon in the world and carry my medical bag with me everywhere I go, and I'll save lives." And that was the plan. 10 years later, I was 19. I was a student at George Washington University, pre-med, and plans to go to medical school. I went home for Christmas break, and my father had this big, thick white neck brace on, and you could tell he was under the influence of some heavy painkillers, and he was limp and numb from the shoulders down. He couldn't lift his arms to even give me a hug to say hello. And so we ended up spending my Christmas break about 6, 7 weeks going from doctor to doctor trying to figure out what's wrong with my dad. And every doctor we went to said, "This is way beyond my scope. You have to go to this other doctor." Well, finally, we ended up in a neurosurgeon's office. The neurosurgeon said, "You needed surgery yesterday. I don't know why you've been waiting so long, but we need to break and remove the bones in the back of your spine. We're going to take the bones out and put rods on the sides. We're going to fuse your whole neck. You'll never turn your head again. You may not regain function of your hands, and we're hoping you have less pain, but there's a chance you'll die because you're old." My father was 70 years old at the time. And but there's such a thing as a young 70 and an old 70. Well, he was the older type of 70, and so there was a big risk with this type of surgery. Well, we talked to two other neurosurgeons. They said the same thing, and we ended up getting a taxi after that neurosurgeon to go home. And I was sitting in the back of the taxi carrying my dad's X-rays and MRIs and CTs and medical records and charts. This is 31 years ago. Today, that stuff comes on one little CD, but back then, it was a big stack of film. And I was sitting in the back of the taxi. I looked over at my dad sitting next to me with, his neck brace. And I could see he's cringing and he's in pain. And because every bump that taxi was hitting was sending this lightning bolt of pain through his body, I could tell looking in his eyes, he just didn't want to live anymore. And I started to have the same panic attack I did that day in the village, where you get, emotional and chest feels tight and heart's pounding and you're having trouble breathing and tears are welling up in my eyes. And this taxi driver looked at my dad and I in the rearview mirror and he said, "Sir, I noticed you're in a lot of pain. And I know you asked me to take you home, but there's a chiropractor right down the street, and I've heard he can help people like you. Would you like me to take you there?" And I was a 19-year-old know-it-all. I said, "No, we need to have surgery. Let's go home." Dad was terrified of the surgery. So he said, "Let's go check it out." Long story short, we show up to this chiropractor's office, and he took a look at Dad's X-rays and MRIs that I was carrying in. He read the MRIs. He said, "Listen, you've got these bone spurs narrowing the canal and pressing on the spinal cord, and it's choking the life that flows from your brain to the rest of your body. And unless we find a way to decompress, this is not going to end well." And my respect level went up because he was saying exactly the same thing that the neurosurgeon was saying, except he wasn't going to cut my dad open. He said, "I'm going to use my hands to adjust the spine little by little, vertebrae at a time, and start to take some pressure off the nerves and the spinal cord. And when I do, your body will begin to heal and self-regulate. And that didn't make any sense to me because I thought the only way you got better was drugs and surgery. But dad didn't want to have surgery and he didn't want to be on drugs for the rest of his life. So he said, let's give it a shot. And this chiropractor said, you're going to need to be here 6 days a week for the next 6 months. Can you commit to that? Dad said, I'll do whatever it takes if you're not going to cut me. And so he did it. He actually went there 6 days a week for 6 months. At the end of 6 months, he walked in. He picked up a pen with his own hand. He signed his own name on the sign-in sheet. He couldn't even hold a pen before, but now he can do everything. He could raise his head, hands over his head. He could turn his head. He was out of pain completely, no pain meds. And it was so inspiring for me that I decided I think I want to be a chiropractor. You get to change things on the inside of the body and you don't have to cut them open. I think that's pretty special. And the other thing that really motivates me from that story is that everyone needs to understand when my dad was sick and suffering and hurting, actually he wasn't the only one who was suffering because my mother suffered because he was in pain. I suffered because he was in pain. And if you don't take care of your health, you're actually hurting the people around you. Most people think they should serve others or help others. But if you take care of your own health, you can do all of that stuff a whole lot better and you can be there for them. So, because all I wanted from my dad was to be there long term.
Awesome. Yeah. And
And so
I
that's
love
what made me do it.
Yeah, and Amir, I love these stories, and that's why we do this podcast because you guys are out there, every day, and there's several cases. I know this is a special case with you and your dad and why you got into it, but almost sure you have several more cases, that you have gone through that you have helped, patients. But what I want to ask you because I've spoken with chiropractors in the past, and they always seem like a tug of war between a chiropractor and a primary care, because I know the importance of chiropractic, but sometimes, it always seems like chiropractic is like an afterthought.
Yeah, well, because philosophically we're opposites. It's like putting the cat and the canary in the same cage. It it doesn't work. And for one fundamental reason. It's a philosophical disagreement or discrepancy. Because the incongruency is this. The medical philosophy is that, and I'm going to make it sound bad because I don't believe in this philosophy. So, it's biased the way I'm telling you, but you can use your own words. Medical philosophy is the human body is flawed. It will decay, it will degrade, it will get sick, and it will die.
Mhm. Mhm.
And so what we have to do is either put chemicals into it or rip organs out of it to keep it alive as long as possible. Chiropractic philosophy states the human body is perfect. It is designed to self-heal and self-regulate. And so when you remove interference and environmental factors that cause it to get sick, it won't get sick and it will be able to heal itself. Now, I can't prove that's right. That's why it's a philosophy. Just like the medical doctor can't prove they're right. There's a lot of evidence on both sides. There's every disease you can think of on the planet in the book, every disease, there is somebody who recovered from it
Mhm.
without drugs, without surgery. If you cut your hand, it heals. Even if you need stitches to hold the edges together, it still heals. And if your bone breaks, when you immobilize it, it grows back together. That's called innate wisdom or innate intelligence. The body knows how to self-heal, self-regulate within limits. If you chop off my arm, I'm not going to grow another arm. I know
Mhm.
that. And that's where medicine is useful. They can reattach the arm. Chiropractors can't. But within reason, we should be able to remove the interference that affects the body's ability to self-heal and self-regulate so that it does those things. And we don't believe that the body is created with a deficiency of ibuprofen or a deficiency of an opioid or any other drug like a beta blocker for blood pressure or external insulin or any of that stuff. And so the body can produce, because your body can produce antibiotics. Your body can produce opioids, which is what endorphins and enkephalins are. When you get a runner's high, you're producing opioids that make you feel good. Every drug has a receptor where your body was created with those receptors way before that drug was created. Why? Because you can produce those things. Everything that's a drug, your body can produce itself. And you have to create the environment for the body to thrive.
Right, right. Well said, well said. And that's why, that's why I believe that chiropractic care should be a part of your regular routine, just as how you do your annual, checkup with your primary
Absolutely.
care doctor.
Absolutely, I agree with that. I agree with that. You get your teeth checked every 6 months, and you get an X-rayed every 2 years. Why don't you get your spine X-rayed every 2 years? That's what our patients do. So, the premise of chiropractic is not just that it's self-healing, self-regulating, but the most important part of that is that your brain and your nervous system control all those functions. See, if I chop off my head and remove my brain, will I live or die?
Yeah, you will die.
And that's a fact. And we don't have
Yes.
to do a demonstration to prove that. It's a fact. Everyone knows that. And it's because the brain controls what happens, everything from there down. And the way the brain communicates with your body is through nerves. So there's a nerve that goes to every cell, every tissue, every organ in your body. And as long as there's no interference on those nerves, you should have the best health you ever had. And that's considered normal. Now, when there's a misalignment in the spine, when there's degenerative changes in the spine, when there's a bulge in a disc in your spine, any type of abnormalities is going to interfere with the nerves that communicate between your brain and your body. And the first thing that happens is called the sympathetic response. Every misalignment, every joint aberration that affects the nervous system results in a sympathetic response. Sympathetic means fight or flight. So part of you goes into a degree of fight or flight. Now, what's the problem with that? Because in fight or flight, certain things slow down. Repair, regeneration slows down. Your immune system slows down. Your digestion slows down. Just like when someone scares you, your pupils dilate, you get pale, your hands get cold, dry eyes, dry mouth, dry skin, high blood pressure. And there are some people who are chronically in that state. And so they get headaches, neck tension, and they go to the doctor and they get painkillers for their neck and painkillers for their headaches, and they get blood pressure medication to lower their blood pressure, and they get cholesterol medication when all they have to really do is reduce the sympathetic response in the body, bring it back to balance, which is what we call in chiropractic your autonomic tone. The tone of the nervous system has to be balanced. We do tests in our office, heart rate variability, where we
Mhm.
run this test and we can tell you exactly how far into sympathetic or adrenal fatigue you may be in and where the balance is missing and how to correct all of that. So what we want to do is create this environment inside of you that is conducive to handling stress. And why do I mention stress? Because how healthy you are is determined by how much stress you can safely handle. If you can only handle this much stress, a little bit of stress will make you sick or
Mhm.
you'll be susceptible to injury. But if your tolerance to stress is high, you're not going to get sick and you're not going to get injured.
Well said. Well said. And but doctor, I know we don't have a lot of time here, but talk to us about your specific technique because I know different chiropractors would have different technique. Talk to us about your technique?
Basically, that's our technique is we improve resilience to stress, tolerance to stress. So our technique involves taking specific digital x-rays,
Mhm.
drawing lines and measurements, analyzing every bone in the spine to make sure everything's aligned properly and everything's moving properly. Then we do a scan, a electromyogram, surface electromyogram, and thermal scan, and heart rate variability to find out which nerves, what areas aren't working properly. We correlate that with the X-ray findings. We make the corrections. We repeat the X-rays, repeat the scans, because we want to see alignment improve and we want to see the nerve function improve. And when that improves, we know you're healthier.
Right. Awesome. And that's great. Um, Talk to us about the community. How do you, obviously you do a lot for the community, but talk us about some ways you engage the community.
Well, one of the things is I've written two books on stress. One's called The Stress Proof Life, which is subtitled The Secret to Health, Wealth, and Happiness. And then a couple years ago, I wrote another book called The Stress Proof. It's called Cracking the Stress Secret: How to Turn Pressure into Power. And so I give talks. I educate. And we do videos on our YouTube channel. We have our own podcast called Real Health with
Hmm.
Brandy and Amir. My wife is
Yep.
Brandy,
Yep.
and we take all the latest news and information about health and wellness. We discuss it, and we present it to you in a way that's understandable, with the focus of helping you feel better, get stronger, live longer, and feel younger.
Tell us some of the mistakes you've seen chiropractors making in 2025. What are some of the mistakes?
The biggest mistake is not communicating the truth about chiropractic. Do you know the original textbook of chiropractic never mentioned back pain once?
Oh,
Has nothing to do with back pain. It's about improving the physiology of the body so it can handle stress. Back pain, chiropractic became a back pain thing when insurance companies started to accept chiropractic. And now every insurance, including federal plans and Medicare, accept chiropractic, but they say it's for back pain. And so people start to believe, oh, if I have neck pain and back pain, I go to a chiropractor. That is false. You don't have to have a toothache to go to a dentist. You certainly shouldn't have back pain to go to a chiropractor. In fact, if you go to a chiropractor regularly, like you mentioned earlier, you'll
mhm.
prevent some of those things, plus other diseases.
Right, right. You're spot on. I've spoken with other, chiropractors, and they're beating the same drum. They're saying the same thing. And doctor, we're gonna shift to another gear here because in respect of your time, as you know, I'm in the digital marketing space. How do you scale your practice? Talk to us about some of the strategy that you've been using to scale your operation.
From a business standpoint, our challenges are operations and recruitment, recruiting talent, because our message is so crystal clear and it's so unique that we are seeing a good level of growth. Our practice has been open for 19 years now. We
Hmm.
have two locations, four doctors, 10 employees. We see close to 20 to 25,000 office visits annually. We're very busy, and the plans are to open our third location within the next year or so, and continue to grow from there. So, from digital marketing standpoint, our focus tends to be public relations. Give back, give as much as you can, give free advice, free information, and just share as much as possible. And I think that's what sets us apart.
And I've noticed you're pretty active on LinkedIn and social media. So I know that must be a part of your practice strategy. What are your thoughts on that in the digital realm, trying to do more things on these platforms to
Yeah.
find those customers or
Yeah, it's a good question. It's a battle because we're going up against a lot of people who put up videos just for entertainment's sake, and they call that chiropractic. But I don't think it's chiropractic. I don't think it's precise enough, specific enough, and unfortunately, it's misleading people. So it's important, and I think every patient would want to know more about their doctor before they go to their doctor.
that's
So
true.
if you search your doctor's name and you're not seeing videos and you're not seeing information about them, and that person's not using digital marketing and social media in a productive way of giving value, then that person's not going to get those patients. They could be the greatest chiropractor in the world, better than us, which is rare, but they're not going to see the patients and they're not going to be able to scale up. So you have to do that.
And you're spot on, and I love that because we have spoken to several doctors and trying to earn their business, and in our in the conversation there, some doctors would be like, Andre, I've been just word of mouth, from day one. I've been in practice for over 20, 30 years, and it's all word of mouth. So I'm like, doctor, if someone is searching for chiropractic care in your ear and they don't know you, and if you're not showing up, they're gonna go somewhere else. So that means you need some sort of digital presence, and as what you mentioned, positive presence, where they can look you up and find what you're all about, because you and I know that patients want to know more about their provider.
Oh
They
yeah.
want to know more, do their research. If someone's going to visit you for the first time, they're going to do their research.
Absolutely. I mean, marketing is three-pronged. Marketing is advertising, it's brand recognition or branding,
Mhm.
and it's public relations. You have to do all three. It's like a stool without three legs, it won't stand. You take one of those legs out, it's going to fall. And so you have to advertise. And most chiropractors I know say, well, why advertise? It doesn't ever produce anything. Well, the story is, there's a company called McDonald's. I don't know if anybody's heard of it. It's a pretty big company. They've got the golden arches. And the story is that McDonald's once one year they decided we're spending billions on advertising, but everybody already knows about our company. Why don't we save that money and stop advertising? Well, the minute they stopped advertising, their sales tanked, and
Exactly.
they had to go back to advertising. And all it is brand recognition. They don't do any direct response ads. It's
Mhm.
just like, hey, McDonald's has this and that and that. Everybody knows. Everybody already knows. Why do they keep advertising? Why does Coca-Cola keep advertising? You have to do it. Now, if you want to be a small business that doesn't get big and doesn't grow and doesn't attract more people and doesn't get a bunch of referrals, don't advertise and don't do any digital marketing. But if you have any aspiration to continue to serve your community in bigger, better ways, you got to be out there, and that's part of it. 10 to 15% of your top line revenue should go towards marketing.
And doctor, that's well said. And it's obvious that you're knowledgeable about the digital marketing process, and you touch on something that's very important. There's no one size fits all, right? McDonald's can do what they're doing because of their strategy. So each practice would be at different levels, and you have to define that strategy and know how you're going to go to market and what works for you. So that's why it's so important to engage with a digital marketing company and engage with an experienced marketer to know what's the best strategy for you and how you're going to take your business to point A to point B. Just like where you are now. I know you're looking to open another practice, so your strategy may be different from someone who's just starting either a chiropractic firm. So that's so important.
Absolutely. I agree with that 100%.
Definitely. Well, tell me some of the things how you're tracking your online metrics to know what's working. What are some of your key KPIs, or what do you normally look at to track your marketing activities?
Yeah, I have different staff members. We call them team members on different analytics. And on our Monday meeting at 12:30, we all get on Zoom and everyone reports what their numbers are, where they were last week, where they are this week, and what they're projecting for next week. And we look at where we are year to date, and we look at a trailing 12 indicator to see, how we've done over the past 12 months. And we look at all those numbers and we make corrections. They say an airplane is off course 99% of the time and it's constantly course correcting. So a plane leaves New York to go to Los Angeles, it's off course 99% of the time. So, but 1 degree difference ends up being miles to the wrong place.
Yeah.
So you have to constantly course correct. You got to be watching your numbers and looking at results, and that has to translate into the bottom dollar, the top dollar, and everything else in between. So it's not just lead generation; it's everything else, conversion and retention, very important.
Well said, doctor. And I'm gonna ask you this. It's kind of out of the way question, but if you could say invest in one thing that you're not investing now, what would that be? You may have to think a little bit, but what would that be? You know you need to invest it in 2025, but you haven't started yet, but it's something that you need to pay attention to and invest in.
So the size that we're at, we're in no man's land because we're larger than most chiropractic businesses, but we're not a big business yet. We're not a mid-sized business. We're still a small business, and so I would love to invest in a maybe a fractional CFO and a
Mhm,
fractional COO. I
mhm.
need an operations person to help us with efficiency and procedures, and I need a financial person, not the tax guy that says you're going to owe this much in taxes, but someone who says, okay, make that investment or don't make that investment, or
Right.
purchase this equipment or don't. And so I think those two things would take us to the next level.
Awesome. Awesome. And those are great because you would surprise to know how much you can save by having more efficient processes in place based on where you are, and that will save
Absolutely.
you a ton of money and it definitely improve profitability. And doctor, I can't believe we're right at the end. I want to tell our audience how can we reach you? Someone is listening, watching. How can they reach you?
I have two websites. One is called midatlanticclinic.com. That's for our practices. My personal website is drrashidian.com. And you can find my books on Amazon. And our podcast is the Real Health Podcast with Brandy and Amir. We have a new episode every single week.
We'll definitely add the information on our site too, to so viewers, listeners can definitely check it out. Amir, it
Thank you.
was great having a quick chat with you. It was eye-opening I like your story about your dad. That's
Thank you.
very touching, and it's always good to hear those, these stories and aha moment of why you got into what you're doing. And so again, it was a pleasure talking to you, and talk to you soon.
Likewise, man, and you're doing an amazing job. Keep it up. Keep it up. You're doing great. This podcast is a great thing, and I know you're gonna continue to grow and expand. Hopefully, people listening are gonna sign up with you and use you for your services. You have skills that they don't have, and there's no reason to go try to learn it yourself. They should hire you and work with you. I think it'll be a win-win situation. No one's gonna regret it.
Definitely. All right. Thank you for the kind words, sir.
Of course.
Appreciate it.